I'm Dr. Cynthia Zarraga, and they call me Dr. Cindy. I specialize in internal medicine, and I care for patients with breathing issues as I do pulmonary as an outpatient. I am a physician working for Bayhealth, Sussex campus. I have always wanted to be a physician as far as I can remember. I was growing up with my aunt, who was an emergency room physician in Massachusetts General, and every time she would study, I would sit with her and review the books with her. And I've always wanted the interaction with patients, and for me, the greatest thing that I can do for them is to help them feel better. My philosophy on patient care is communication and trust. Communication, because if there is a clear pathway to the patient and the doctor, the trust is going to be developed. Patients with increasing shortness of breath would be the most common that would think of a pulmonary specialist. But wheezing, congestion, recurrent sinus infection, cough would bring a patient to their local doctor, but eventually will be referred back to me for evaluation. When a patient comes to me with a problem, we discuss their symptoms, we discuss the tests that are possibly needed to be done, and I explain to them their options. I explain to them what the pathology is, and in simple words, we talk about what we can do for them, but I always emphasize they make the final decision. This is not up to me. This is both of us putting our input so we can arrive at a plan that will be comfortable for both them and for me. I make sure I answer their questions to the point that they understand and to the point of their satisfaction. When I see young, healthy patients, I encourage them to do their regular physical exams, blood work, because being proactive is to care for yourself, because down the line, it will be too late if there's a medical condition that we do not catch at this point. I always encourage them, because if they want to live their lives and they want to be happy and healthy, they have to have regular follow-ups with their doctor. And it doesn't always have to be physical. It could be emotional, it could be social. Some of them, they just need to talk to somebody else. So once a year would be the best follow-up, and the recommendation would be to know their physical history from their parents and talk to their doctor. This is why it's important to have the communication with your primary care, because you need to speak and let them know what's going on with you so you can feel that you're understood.